Good afternoon, ladies and gentlemen. Welcome to this new segment of Medcast. Medcast is a new groundbreaking TV program designed to bring you closer to the world of health, wellness, and medical innovation. Whether you are a healthcare professional, a curious viewer, or someone looking to stay informed, Medcast is your go-to source for experts' insights, cutting-edge treatments, and stories that inspire. Each episode dives deep into the latest achievement in medicine, interviews with top doctors and specialists, and real-life stories. From exploring breakthroughs in technology and treatments to tackling everyday health concerns, Medcast empowers you with knowledge to live your healthcare knowledge. Today, we are pleased to have Dr. Mohammed Jawad, who is specialized in endocrinology and diabetes. Dr. Mohammed has graduated from the College of Medicine in Kuwait University and is a board certified in the Kuwaiti Board of Internal Medicine and also a holder of board certification of endocrinology. Welcome, Dr. Mohammed.
Thank you for having me.
We
Thanks a lot.
are so pleased to have you today as the first episode of Medcast, and it is our honor.
Thanks a lot. It's my pleasure.
Dr. Mohammed, surely we are having so many medical trends these days in the medical field, and especially with the population with an increased use of the GLP-1s, you know. Now, everybody is intending to use the GLP-1s as a losing weight medication. We need to know what is the GLPs.
Yes, sure. Thanks again for having me. GLPs stands for, it's a class of medication, stands for glucagon-like peptides. It's normally found in the gut in humans, and it is secreted there to control hunger and to control movement through the bowels, the bowels contractions, and thereafter controls absorption. Also, it has other functions. For example, it induces blood glucose absorption into the muscles, gives signals to the brain, satiety center. So this is normally found in humans.
Which is, I think, is normally secreted after the normal user or the person having a meal or something.
Yes. When the person eats, this local hormone, if you'd like to say, tells him, "Khalas, stop. You're fine now.
You're stuffed.
Yes, you're stuffed. Exactly." So basically what they did, they found that this medication, this normal hormone, controls sugar, blood glucose, I mean, especially after the meal. So earlier types, when they were manufactured, glucagon-like peptide GLPs, it had quite a good action on controlling blood glucose. And they also noted that it causes weight loss. So it's been there in the market maybe more than 20 years, probably more than that. I've been working in diabetes for approximately 20 years, 25 years, 20 years, and or less a little bit. And it's been there for a long time. So recently, advances have been carried out in the older generation of GLPs to newer ones, which basically target mainly weight control. Yeah. Of course, you get also the controlling glucose, which is amazing, to be honest, and as well as weight loss. So that's basically summary of GLPs.
That's great. Well, you know, some people now they need to use these medication normally without a prescription and without even going to a healthcare professional or a doctor or having an advice from like a pharmacist or someone. Do you recommend that use?
Of course not. Of course not. Any medication actually should be prescribed by a specialist, especially these widespread medications that are quite potent in controlling glucose. It also reduces blood pressure. So I advise strongly that if a person intending to use GLPs, to be at least supervised by a healthcare professional and preferably a specialist in the field. Yes, and I agree, people are using this for weight loss only without being diabetics, which is quite fine, agreed upon, scientifically proven that these medications can be used in patients with simple obesity only, non-diabetics, with amazing results also.
Does that mean that if people feel they are obese enough, they can use it immediately, or there are some like terms of initiating these medication in patients?
First of all, they should seek medical help. There are certain laboratory investigations we require the patient to do before taking these medications. Most importantly is checking if the patient has any thyroid problem. Actually, thyroid dysfunction by itself can cause obesity.
Yeah.
So you're treating obesity with a medication, but you have a hormonal reason,
Yeah.
hypothyroid, for
Yeah.
example. So that's one of the important tests to be done, as well as glycated hemoglobin, which is HbA1c.
Mm.
We have, unfortunately, in the population, huge number of diabetics and huge number of pre-diabetics, which are not known. And
And some patient doesn't feel it as well.
exactly,
Yeah.
and there are no symptoms, especially in pre-diabetics. So we advise the patient to do these blood tests before taking the medications. Do not take the medications just blindly like that. And also, the patient has to know the side effect profile
Yes.
and the contraindications of these medications.
That was my next question, actually.
Yeah. So contraindications, if you want to know about contraindications, there are few ones.
Mhm.
It's generally safe medication, GLPs, I mean. The contraindications, first of all, history of pancreatitis, inflammation of the pancreas, especially if there is no known cause for it, idiopathic pancreatitis. Sometimes you get pancreatitis secondary to other medications, sometimes because of gallstones. There is a way that we can use GLPs in this type of pancreatitis. Of course, after healing, after probably 6 months to 1 year after the episode. But this is one of the important contraindications. If the patient has recurrent pancreatitis for unknown reason, GLPs should not be used because it can induce pancreatitis. That's one. The other contraindication, if the patient has, of course, if the lady is pregnant or seeking pregnancy, soon she might get pregnant. It's not advised to use GLPs because
I
we
think
don't know
there are no enough studies
exactly.
showing
Still,
the efficacy.
yeah.
Yeah.
So there is no clearance for to be used in pregnancy or especially in the first 4 weeks, 4 to 8 weeks
Yeah.
of pregnancy, formation of the baby, you know. So that's another contraindication. Another contraindication if the patient has history of certain type of thyroid cancer.
People think that it is general of cancer.
No,
I mean general types of cancer.
no, it's
Yeah.
only probably one type,
Yeah.
which is medullary thyroid cancer, which is a rare entity. Usually it's a familial type of thyroid cancer. It's not common. And I have seen in many years of working maybe 1 or 2 cases of medullary thyroid. If the patient has history of medullary thyroid cancer treated in the past, he should not be using GLPs because not that there are cases of medullary thyroid cancer. No, but it's been proven to develop in lab studies, lab rats. They developed with huge doses, with large doses of GLPs. They developed medullary thyroid cancer. So to be cautious,
Yeah.
not to be used in patients with history of medullary thyroid cancer.
Now, the most two common questions regarding the use of GLPs, they always ask if the patient is having thyroidectomy.
Yeah.
Can he use the GLPs?
Of course.
Yeah.
Thyroidectomy, not because of thyroid cancer, of course.
Yeah.
Patient had, for example, for cosmetic reason, or the patient has some other forms of nodules. He decided to do thyroidectomy, and he's now currently in hypothyroid status. He can use, no problem. Even if he did not remove his thyroid. With the patient, we see this a lot in the common question in the clinic. The patient comes, says, I have hypothyroid. I take medication for thyroid. Is it okay to use? Yes, it is okay. The same for hyperthyroid. Thyroid diseases in general are not a problem with GLPs. So yeah, there's green light. They can use it.
Great. Now, regarding the age, from your point of view, I know your point of view is based on scientific journals or studies. From which age you always recommend the start of the use of a GLPs?
Yes, there is a general agreement that it should be used above 18. Some exceptions are there for certain GLPs, the daily type. I don't want to mention names, but certain types that are given daily, there is agreement even before the age of 18. Younger age of diabetics, younger age of diabetes and obesity, we can use below 18. But the famous ones now, common
With
the
the weekly ones,
population,
you mean?
the weekly ones,
Yeah.
it has to be above 18. But there is a problem here, if I may, just to be quick about that. People should not rush,
Yeah.
especially in this young age, 18 years, 19 years. If the patient surrendered, let's say, to using medications at this young age, this young man or young woman, they will face lots of problems in the future.
yes.
This is it's an escape. They are not they should exercise, they should do diet properly. They're still young.
Yeah, we do have other solutions as well regarding making a diet, as you said, and also I think it's somehow unaccepted by the teenager himself, let's say, to use a daily injections. If it's like with the weekly ones, he might be accept using it because it's giving him more ease to control the dose.
Of course,
But
yes.
with the daily ones, it's very difficult. Now, to finalize this great conversation regarding the use of the GLPs. Now, do you recommend the patient is having a regular follow-up or checkups like during the use if he's using them for the long term?
Yes, we generally recommend the patient follows up regularly every few months. First of all, to explore if the patient developed any side effects. Secondly, the patient occasionally, when the patient loses lots of weight, especially with this type of patients where they lose lots of weight, they might develop other issues. For example, gallbladder stones.
Gastroparesis as well.
Exactly,
Yeah.
some gastric issues also. So side effect profile we monitor through the regular follow-up. And in terms of labs, to be honest, there is nothing to follow in the labs, except if the patient is diabetic, where we need to follow his HbA1c, his blood glucose control. Usually the patient using GLPs, especially the new ones, the potent ones, their blood glucose is dramatically improves. So we need to follow so that we can cut down the other medications. For example, the patient is using insulin also, or other form of tablets for diabetes, and his blood glucose is fantastically controlled.
Then we can rely on the
Exactly.
GLPs alone. Yeah.
So we should stop or reduce at least the other medications. So that's the purpose of follow-up. Yeah.
That's so great from you, Dr. Mohammed. We are so pleased to have you today, and hopefully we can see you again here.
Thank you.
Thank
My
you very
pleasure.
much.
Thank you very much.
Thank you for watching this episode of Midcast. We hope you found today's discussion insightful and empowering. Remember, staying informed is the first step toward better health and well-being. Until next time, stay curious, stay healthy, and stay tuned to Midcast, where we meet healthcare professionals to know your health better. Take care, and we will see you in the next episode. Goodbye.